Yes, I'm a GP, I'm a doctor. Is there anyone from Sheffield here? Hooray! I say that the NHS is about cooperation. As we've just heard, it's about cooperation and solidarity. It cannot be about competition. David Cameron's mantra, I hear it more and more whenever he speaks, is Great Britain is winning the global race. And when he says that, I think, what does he mean? Well, I know he's quite interested in the arms race, because he's recently said how much he supports Trident, which costs 100 billion, which would keep our accident and emergencies going for 40 years or so. So that's part of his race. I know he supports the race to have the lowest paid workforce. He wants a race to have the smallest welfare state. And he also wants a race where GB, Great Britain, is the most open to privatisation. And when he goes on about winning the global race, I sometimes wonder what losing the global race would look like. Competition is at the heart of Tory policy. That's his version of winning the race. And it's at the heart of the Health and Social Care Act, which came into force just this last Monday. Now, the Tories claimed that they were appeasing their Lib Dem partners in coalition, and they said that they were going to rewrite parts of the Act so that there was no more competition and privatisation than there had been under New Labour. However, when the regulations came out, and the Lords have just scrutinised them, Section 75 is the crucial bit, and it is clear that this will not allow the commissioning groups to do anything except go out to multiple tender. They have got to go out to competition, and this will be totally destructive to their best efforts to run a cooperative, integrated, organised, planned service. As we've heard, we need an NHS which is comprehensive, which is integrated. We need an NHS which is about health, not just sickness, which is about prevention. I know as a GP, I spend a lot of my time dealing with acute problems. People come with whatever on their mind at that moment, their illness at that moment, but all the time, because I can care for them in the long term, I can think about preventive health. And at the moment, we're hearing how in Wales there's an outbreak of measles. That's the beginning of the NHS breaking down, where we don't have a structure that cares for everybody from cradle to grave and can do that preventive work. It simply will not work if we have private companies cherry-picking the most lucrative parts of that comprehensive service. So coming from Sheffield, I want to tell you, thank you, what Sheffield Save Our NHS has been up to. It's quite a big, active group. It's great. There's all parties, trade unions, everybody is involved, and it's working in a non-party political way. One of the things we've done is highlight the services which are already being privatised. We've got a walk-in centre which is run by One Medicare, and we've had demonstrations to highlight the fact that when people go in there, although they think they're going to an NHS service, it's being privately provided. It looks as though our minor injuries unit may be closed, and we've been campaigning around that. And again, this is a great myth that the Tories are not cutting the NHS. Actually, there are massive cuts affecting the NHS. And of course, coming from Sheffield, we have been lobbying the Deputy Prime Minister. In fact, we have been laying siege to Mr. Clegg's office in Sheffield. And this afternoon, Clive Peedle, who's from the National Health Action Party, you must have heard of this, he's doing his Cleggathon, running from Leeds to Sheffield, with dressed as Mr. Cameron, with his poodle, Mr. Clegg, little yellow poodle, running along beside him. And I'm going to rush back to Sheffield after this in order to greet him outside the town hall and do that last bit up to Clegg's office. So finally, what can we do? Well, I think it's really important that we raise awareness about what's happening, that this threat is actually upon us now, and I think most people don't realise. They think, well, I'm waiting a little bit longer for that appointment, or Yesterday I referred somebody to hospital and the ambulance didn't come for 4 hours. And people are just fantastically patient, but we need to tell them what's happening and what's going to happen. The other thing is we need to all adopt a Lord so that we can get the Lords to call this in and really play hell with the other house, with the Commons, when they call it in on the 24th of April and actually reject the regulations as they stand. And then whatever happens on the 24th of April, we need to support our clinical commissioning group. Certainly the one in Sheffield has committed itself to doing what it can to using local continuing services rather than putting things out to tender. But they're going to be under enormous pressure from the government and from Monitor to put everything out to competition. And the more that we get behind them and question them and hold them to account, the stronger they will be to stand up against what's being thrown at them. And then finally, yes, I think this is part of a much wider attack, a wider attack on public services publicly provided. So we all need to be lobbying our politicians, whether it's local councillors like me, or MPs, or would-be councillors and would-be MPs, and really holding them to account and say, do you care about our public services? And do you care that they're publicly provided? And will you bring them back in and stop making contracts with private companies? Thank you very much.